Hello and welcome to the Destination Zero Year-End Fatality Report and Program Series. I'd like to thank everyone for joining me and the National Law Enforcement Memorial and Museum. For the first time, 3 programs will be broadcast featuring one-on-one discussions between distinguished experts designed to provide insight into reducing officer deaths in response to the trends found in the Year-End Fatality Report. This year's series of in-depth interviews will focus on officer deaths in the categories of firearms, traffic, and health-related causes. Firearms were a leading cause of officer deaths in 2020 and have historically been a consistent factor in line-of-duty deaths. In the last decade, 528 officers were shot and killed, constituting the largest single cause of officer deaths in the line of duty. In 2020, that trend continued, and we are sad to report an additional 48 officers have died due to firearm-related incidents. Today's discussion is designed to support law enforcement agencies by promoting law enforcement officer safety and preventing firearm deaths nationwide. As a former organized crime prosecutor who prosecuted many death penalty eligible cases, I worked to keep illegal guns out of the hands of criminals throughout my 20-year career, but I fully recognize there's much more to do. I know that members of our law enforcement community nationwide put their own lives on the line each and every day in order to keep our communities safe. That's why, in Congress, I will always advocate to expand and support funds for law enforcement. We must ensure officers have the necessary equipment and resources to promote and strengthen their critical role in our communities. I welcome all of you from around the country and thank everyone for supporting these crucial efforts to enhance law enforcement safety in the line of duty. I would like to now turn it over to the CEO of the National Law Enforcement Memorial Museum, Marcia Ferranto.
Thank you, Congressman Katko. We are honored to have you as our guest this year for the Destination Zero Year-End Fatality Report and Program Series. To all our law enforcement community and supporters, welcome. It is our mission to honor the fallen, tell the story of American law enforcement, and keep names off the memorial walls through our safety and wellness programs. Before we get started, I would like to thank Verizon for serving as lead sponsor of the Destination Zero program. As our valued partner in honoring the fallen and making it safer for those who serve, Verizon's commitment to supporting our mission continues to expand, and we are grateful for their contributions. As the leading authority for line-of-duty deaths, the National Law Enforcement Officers Memorial Fund has released its 2020 Law Enforcement Officers Fatality Report. The stringent review process includes agency submissions, medical review, and committee review to qualify the deaths as an official line-of-duty death. This program is designed to provide you with expert accounts and strategies to help prevent future fatalities in our 3 primary cause of death categories: firearms, traffic, and other causes. Today's program will focus on firearm-related fatalities, which were the second most common cause of officer deaths, with 48 officers killed in 2020. This represents a 6% decrease from the 51 officers killed in firearms-related incidents during the same period last year. The leading circumstances of firearm-related fatalities were officers investigating suspicious persons or activities, following by attempting an arrest. Ambush attacks leading to officer deaths remain consistent compared to the same period last year. Here with us to discuss how officers can protect themselves and survive during these encounters are Dr. Alex Eastman and Superintendent David Brown. Dr. Eastman is the Senior Medical Officer at the Department of Homeland Security's Countering Weapons and Mass Destruction Office. In this role, he is responsible for operational medicine across DHS, in addition to countering threats to the United States worldwide. Dr. Eastman is a task force officer with ICE, Homeland Security Investigations, and is assigned to the Special Response Team program. Dr. Eastman is also a Dallas Police Department lieutenant, the chief medical officer of the Dallas Police Department, and the lead medical officer for the Dallas Police SWAT team. He is board certified in general surgery, surgical critical care, and emergency medical services. Dr. Eastman was recently awarded the Dallas Police Department Medal of Valor for actions taken during the July 7th, 2016 police ambush. Joining Dr. Eastman is Chicago's Police Department Superintendent David Brown. Superintendent Brown joined the Chicago Police Department in April 2020, becoming the 63rd superintendent. He brings more than 30 years of law enforcement experience to Chicago and is nationally recognized for his expertise in reform, public safety, and community policing. He most recently served as chief of the Dallas Police Department from 2010 to 2016. While leading the DPD, the city saw a historic reduction in crime and the lowest murder rate in over 80 years. During his tenure as chief, he guided the department through the worst police shooting in the nation's history in July 2016, where 5 police officers were killed and 9 others injured, along with 2 civilians. Superintendent Brown is also the author of the memoir, Call to Rise, which details his personal stories and tragedies, including the deaths of his son, his brother, and a former police partner. I want to thank both Dr. Eastman and Superintendent Brown for taking the time to discuss their strategies to reduce the number of officers shot in the line of duty. To all of our viewers, thank you again for being with us and learning with us, because together we can prevent future law enforcement fatalities. I turn it over now to Dr. Eastman and Superintendent Brown.
Good afternoon, Superintendent Brown. Thanks for joining me today to talk about firearm deaths and law enforcement. As you know, the Memorial Fund in its year-end report has done quite a bit of work in characterizing these fatalities, and I think it's an important topic for us to get together and discuss. Full disclosure to everyone here, Superintendent Brown and I go way back, and it'll probably be everything I can do not to call him Chief Brown during the course of this conversation, because that's who he is to me. So bear with me as we get through it. Chief, good afternoon. Glad you're here, and give us a little warm up as to why this is an important topic for you, sir.
Thanks, Dr. Eastman. I really appreciate the time, and I thank you to the Memorial Foundation for putting this on. I think it's a critical issue, primarily because we oftentimes, just follow the headlines about what's happened in 2020. It's been a year like no other, but this really is a longstanding issue as it relates to gun violence in our country that law enforcement is on the front lines for, and we need to really, on a regular basis, discuss all of the dynamics that associated with it, because much of the discussion oftentimes can lead to policies, procedures that will save lives.
Great, sir. Thank you. And I think, it's interesting. When we sat in your office on your first day, we looked out over Chicago. I mean, you literally look out over the city of Chicago, and coming from the state of Texas, where guns are so prominent, to Chicago, where the level of gun violence certainly well documented. What do you think? Tell me how the adjustment's been, and certainly, we've talked on a number of occasions after officers have been fired at or wounded there in Chicago. I think it's a unique environment. How's the transition been?
It's been quite a transition. I came in at the beginning of the pandemic, and so my first week we buried 3 officers who died from COVID-19, and the impacts reverberated throughout the organization. It's been a chilling effect of officers who are brave and courageous, but they don't want to take something back home to their families. And so officers generally draw the line with protecting their families, but they're willing to take risk their own lives, but they don't want to bring COVID-19 back home to their families. So it's been quite the transition into the COVID-19 environment. And then a month later, the tape of George Floyd being murdered by the officers there in Minneapolis comes out, and the perfect storm of not only a global pandemic but also the outrage and the righteous outrage in many instances regarding George Floyd's death ensued. But let me just say one thing about guns in the state of Texas versus the state of Illinois, and this has been shocking to me this year, Doc, that the state of Texas, according to the FBI documents on criminal background, logs 2.2 million guns legally bought in Texas. In the state of Illinois, 6 million in 2020. It's an interesting dynamic that more people own and buy guns in Illinois than they do in Texas. And I never would have suspected that to be a fact.
Yeah,
but it is.
That's shocking to me. Shocking. And I'm glad to hear you bring up George Floyd's murder, because I think that really tees up the conversation. So much of what we've talked about this year in law enforcement has been, how we respond and how we regain our legitimacy with communities. And I think when you hear the cry to defund the police, a rallying cry we all have heard loud and clear, and many places have seen and felt, when you get down to talking about what you need to effectively manage a big department, or a little department for that matter, effectively manage a department, you need money to train and do all sorts of things. So how I mean, you have been, obviously we talk all the time, and I think that, you watch what you do there. You've been able to do quite a bit in Chicago that I think people would find in terms novel initiatives in terms of gun violence and officer safety. How do you balance the two, the call to defund the police, knowing that you need resources to make these programs happen?
I think number one, Doc, to really try to understand this defund the police discussion, I think it was a pendulum swing that went too far. And if you pay attention to the current conversation about defund, it certainly has swung back more toward the middle, and with much regret for the cities that actually pursued through budget cuts a defund the police narrative. I think I could argue Minneapolis and other places have deep regret with the defund movement. It just was a pendulum swing, obviously an emotional reaction that went too far. We likely need to be somewhere in the middle with building up social service networks and resources while funding the police. Who will take the 11,000 guns off the street that the Chicago police officers have taken off the streets this year? Social services can't do that. When you have extraordinary gun violence, we can't put social service workers in harm's way to do their great work. There's a role for police, there's a role for social service workers, and thank God the pendulum has swung more back toward a more sensible discussion about this.
Yeah, I think that's extremely well put, sir. There are legitimate discussions that need to be had, and I think that pendulum finding its way to the middle is something we've really struggled as a profession. So many folks certainly don't know this story, but Chief/Superintendent Brown is responsible for me getting on Twitter. One time we were sitting in his office having a conversation about, I went to him, I said, Chief, tell me about this Twitter thing, because I see you all over it already. And as evidenced by his now near 70,000 followers, I don't have nearly that many. But, he said, look, this allows me to deliver the message directly to our folks. And I think it was a stunning lesson for me to learn then, and one that I've tried to follow in his footsteps since. So Chief, tell me, how do you balance, the demands of sort of morality in law enforcement and social media? Everybody's got a camera pointed at us now. How do you balance it as well as anyone I've ever seen? So will you just talk to us a little bit about how, and especially in the way, today with everything that's going on?
Yeah, one of the things, Doc, and great question, because social media now is how most people get their news, that they interact more on social media than they do with print media and or network TV, that people, to include cable news. I mean, most people particularly people we're hiring as police officers. Every police academy, you ask the question in the academy, and I do every academy class that comes through Chicago. I did the same with Dallas. Where do you get your news? They all raise their hand when you say social media or internet. No one raises their hands when you ask who watches the 6 p.m. or 10 p.m. news on network TV, or who watches MSNBC, Fox, those news networks to get their news, or read the local paper. Most officers get their news from social media. So if you want to brag about the great work officers are doing, for them to hear it and be encouraged that you acknowledge their hard work and sacrifice, you have to do that on social media. So there is one lens of social media, is that to keep your workforce encouraged and keep them, pushed in the right direction, because they don't feel like it's us against the world. But in addition, it's where you can have a full discussion unedited with what has transpired. So video clips of your discussing the day's crisis moments is unedited, where if you're on any other mainstream media, much of the things you say that are positive about your response, even in a hypercritical environment, gets edited. And it never makes the airways or the front page. And so if you can, get your comms or your PIOs, your public information office, to push your message out, particularly during crisis, on social media, and be open and transparent. It's one of the few places where you're not getting edited and not getting your full message out.
Yeah, that is just so on point. Let me switch gears on us again, because I think, you and I have worked a lot of crises together over the years, and I have learned a ton. And I think one of the early lessons was, the idea, and we certainly preached this, on the unit we were both in Dallas. We preached, the idea of slowing the situation down quite a bit. And I think that is in a way what the idea of de-escalation is. And so when you think about, the way you handle a crisis and how you slow things down, especially when we talk about gun violence and the response to it, both against law enforcement officers and how much of it we see. Tell me a little bit about how you slow things down and how you bring that to practice.
One of the things I try to do is make the case where everyone can easily understand what de-escalation really means. So just think about the old Wild West and the quick draw. It's the fastest out of the holster, that's who wins. If you're slow out of the holster, you get shot and killed. That's the worst case scenario. You never want to put yourself in a quick draw scenario where the fastest draw wins, because a lot of dynamics can happen to where you're at the wrong end of that quick draw. And what you like to do is give yourself time and distance to make decisions. Despite the quick draw, just set the quick draw aside. Think about how critical every deadly force encounter has become. That likely it's caught on tape. Likely that tape is shown in clips, not in its entirety. So give yourself time so that you can make the right decision. The fastest decision is oftentimes not the right decision. And you do that by giving yourself time and giving yourself distance. And it's an officer safety issue, Dr. Eastman. To be quite frank with you, the more time you take in resolving these deadly force encounters, the more likelihood of you surviving. That slowing things down, creating time and distance, creates a high level or a higher probability that you'll survive that deadly force encounter, because you have time for cover, you have time to get officers there to assist you, you have time to talk people out of doing what they are trying to do. So time and distance has a lot of dynamics. And finally, from a leadership perspective, give yourself time and distance before you make decisions. Many leaders make the wrong decision because they're rushed for political reasons, or they're rushed because they really haven't really dealt with that type of scenario, and They don't know that just with a few more minutes of time that they likely will make a different decision. So it has a lot of elements, de-escalation does, that can benefit law enforcement in, number one, surviving a deadly force encounter, number two, making the right decision.
One of the things that I was struck by, and I think you were as well after July 7th, was how we go back and process critical incidents. When you have a law enforcement fatality, an officer that's killed in the line of duty, it profoundly affects, far more people than are involved in the actual incident. And so I want to take a few minutes to talk about debriefing, after action, Monday morning quarterback, and it's got so many names. But you and I went through July 7th together, and I think the way, and we've talked a lot about how an agency and individuals come back from that. Tell me, what. Let's talk about after action, debriefing, and recovering from an officer involved fatality, and how you think, what are your thoughts on the best way to do that?
Yeah, one of the things that after actions can do or debriefings can do, it can actually be great therapy for everyone involved. Because most of the time we are all having nightmares and reliving and dreaming and thinking about what we could have done better. What could we have done better? Did I do everything right? You're second guessing yourself. So after actions can be a little bit of therapy. But in addition, after action can also improve tactics and training so that the next time you deal with something similar, that you are much quicker in your response and you do it in a safer way. You got to start with, we can always improve. That you can't think about, I don't want to critique what we've done because of a civil litigation, or because I'm afraid that internal affairs is going to suspend me because I didn't do something right. You got to look at after actions and debrief as, number one, therapy for those involved, but also more importantly, this can improve training and tactics, which will lead to officer safety. And how you can protect yourself and wrap litigation and our internal affairs is have attorneys, your city attorneys or your lawyers for your city involved in it after action. Number one, they have a role to play in looking at and sharing with you things you could have done better, but they also add a layer of privilege that overcomes, FOIA and other types of things that are nefarious to getting to a clean critique that benefits the organization and everyone involved, so that everyone can be safer the next time you deal with it.
Yeah, such great points. I think one of the things that I remember very clearly about the days after July 7th were just how much we had to respond to people who simply weren't okay. And I think one of the things that we did well and that I'm proud of is that we really made it okay for people not to be okay in the days after something like that.
That's right. That was critical. And I had a lot to learn in that area of mental health. I mean, that therapy piece to debriefing is really about officer wellness, that people have these misgivings about what they did. Did they do enough? Did they do all they could do? Cops are really hard on themselves. They really are. And for them to be well, they need a path to being able to say, I need to talk to a peer or a professional. And that needs to be an open offering with no stigma attached to it. For officers to be okay on the other end of this. I mean, we want them well for their careers, but we want them well for their families as much as we do for them to come back to work.
And I made that offer then, and I'll make it now to anybody watching this. You've got an open door from me, and I know from the superintendent too. If there's, we would not let a brother or sister struggle. We haven't, and we won't. So please reach out, sir. Time is drawing to a close here, and I know you just have a big city police department to run. No big deal. So tell me, final thoughts on the topic before we close.
I think number one, I think we hit it on at the end that everything we've discussed, de-escalation, debriefing, defunding the police, and what budgets have done and what impacts from COVID-19 on policing has as a linchpin. You need officers well enough to execute some of these very challenging components of policing, that officers have to be well enough in order to transform policing yet again as society figures out where this pendulum swinging is going to end up landing as we transform yet again the policing landscape. But again, the most noble profession, Doc, brave, courageous women still willing to risk it all to protect us while we work and enjoy our families. And so I just want to end with happy holidays to police officers everywhere and to their families and to my new heroes, all the healthcare workers. Thank you so much for all you've done for this country.
Well, Chief, as a guy who wears both hats, thank you. And certainly thank you for not only your leadership, but your friendship and mentorship along the way. I always look forward to catching up. So, and again, thank you to the Memorial Fund for focusing on, these causes of death. The end of the year report is sometimes difficult to read, but I am proud to be able to work with you and the Memorial Fund to help make the job of being a law enforcement officer in the United States more safe every day. Thank you all for joining us, and be safe out there.
Thank you, Dr. Eastman and Superintendent Brown. Your candid discussions has provided us with unique opportunity to think about and implement strategies that will provide the support officers need to enforce the laws of this country more safely. Again, I would like to thank our corporate partner, Verizon, for helping us keep officers' names off the wall through their commitment to our mission, to making it safer for those who serve. In an effort to provide this life-saving information to as many officers, departments, and agencies as possible, you can access today's discussion anytime on our website and through our social media platforms. Thank you again to Congressman Katko, today's guests, and to all of our supporters. To our law enforcement officers, stay well and be safe.